La Frontera, or the U.S.-Mexico border, it's sometimes poorly understood. Despite the fact that we can have these awful structures that try to separate and create demarcations and see the other as different, El Paso is the passage. So that poses wonderful opportunities, but also challenges. I'm thinking through the lens of health. For people's health, there's just no way viruses and bacteria carry passports. So there's really no border and no line that you can trace.
What keeps me up at night at times is that this fence feels like a mirror in so many ways. So many of our friends who come from outside the borderlands to visit for the first time are enamored with the external fence, and yet, like a mirror, it reflects back the invisible walls all throughout the nation. Don't go over there. Watch out across those tracks. And so part of what's on my heart these days is how narrative impacts health, and lives are literally at stake.
When you are living in a community such as El Paso, you can feel what poverty looks like. And unfortunately, we have normalized this desperate need of services, and we do with what we have. And so when there's so much evident need, we come together for the common good. The Hope Health Fair started in 2016 to bring services to where the community members are. Services that address the needs of migrant resources, recovery, mental health, behavioral health, immunizations, oral health. So most of the individuals that come to our health fairs haven't seen a provider in the past 12 months. Many of them is their first point of contact into prevention.
We're a partnership of 89 organizations in the community. We have several immigrant guests from shelters already in the line.
I'm picking up my loaf of bread. Wait a minute, there's a COVID booster, but could I also get a referral for recovery? Is there a place where I can sign up to talk about nutrition? And wait, is this a place where I can have my first hearing screening? Not only are they being informed, but they're being referred and they're being follow-up.
We've been able to register several patients for our clinic, and our outreach team is out here providing that transportation to our clinics, and it's just beautiful to see the faces of a lot of people who haven't seen a doctor in many, many years. And so the fact that we're here for the community, that is just the amazing thing about this health fair.
10 years ago, I was homeless, and I went to the Hope Fair, and I was having trouble with my eyesight. I was going blind. I was to the point of, actually suicidal. And thanks to Hope Fair, I was able to have 4 different surgeries, and now I can see fine. Everything's free. There's some homeless, there's community members that are low income, large families that are struggling. Every aspect from hunger to mental health to hygiene, it helps everyone.
We can't do this without students, and this is about getting them ready for the workforce. We're adding a dimension of humility and exposure so that the next generation of professionals are better equipped to refer to the individual that is marginalized as an individual that is worth of dignity and respect.
Being a border town, a lot of people are uninsured and they don't know where to go for resources. There is a language barrier, so trying to go somewhere to get the services that you need to help you, especially given your status, that's a big barrier. So this fair is to try and allow people to just get the help that they need without anything blocking them. And a lot of people are just grateful that we're not looking at anything aside from the fact that they're a person and they need help.
We're very happy to report that as of last month, we were close to 1,000 individuals being reached. With yesterday, the 500 and plus, we're gonna be most likely at 1,600 individuals. Hope is working. It's because you and us together, we make it happen. Otherwise, there's really no hope.
What HOPE represents is the fact that we need to continue to work together and enhance what we're doing. How do we expand on that?
35% food insecurity in El Paso. That's 300,000 people. In any other community, it's an enormous crisis. In El Paso, it's been the way of life for too many years to count. We see the pantry line as the entry point to all the services that we can expose people to.
You need to have a heart to serve the community. And HOPE is the big resource, and they are going to do 4 surgeries if they need surgery.
To us, it's very little that we do, but maybe that little can help a lot.
Together, we figure out a way, regardless of what differences of opinions we have. And if we don't thrive together, we're going to fail together as societies. And so in this region, there's something that is happening, which is humanity at its best.
So we've been collecting border ladders since 2021. By the time someone gets access to one of these ladders, they have paid $12,000 to $15,000 per person. So each of these represent the plight of our migrant neighbors seeking asylum and refuge. Yes. Even in the middle of the pain, there's always a sense of the resilience and the tenacity and the hope of our neighbors is incredible.
The negative narrative is fear the border, but it's all about blaming the other. For those of us living on the US-Mexico border, we come together. Yes, the wall is a physical divide, but then there are the bridges which connect, and that's the people. Borders are places of encounter, of joy, of co-creating. It's about how communities come together to heal, finding another way to really live people's lives in a very dignified way of doing health and healing. And it feels like comforting because we're not doing it alone.